going to be talking about mental health awareness. And so why choose mental health? We did a survey of a few college students, and we had 5 options. 42% of those students responded with wanting to learn more about mental health. And this is just because it isn't talked about much, so we wanted to spread some awareness about it.
So the mental health disorders that we're going to be talking about today is anxiety, stress disorders, sleeping issues, depression, suicide, self-injury, eating disorders, and addiction and substance abuse disorders.
All right, and so for anxiety disorder, it's usually caused by an emotion characterized by feelings of tension, worried thoughts, and physical changes. Some of the most prominent symptoms include hyperventilation, tachycardia, and hypertension, but there's some other ones as well. And then some coping mechanisms that you can do to reduce anxiety in your life could be doing breathing exercises, limiting your alcohol and caffeine consumption, and then just knowing that not everything, that you don't have control over everything. So yeah, as well as others.
Sleep disorders are a huge aspect of mental health, and some of the most prominent symptoms include trouble falling asleep and trouble staying asleep, and excessive daytime drowsiness. Some of the coping mechanisms include exercise, which is proven, SSRIs, which are antidepressants from psychiatrists, and stimulant medications. Some of the side effects that these can help are the brain function and the increased risk of other health problems.
Depression is a mental condition where one feels severe feelings of sadness and loss of interest. Some causes for college students are social media, making new friends, being away from home, and the stress of school. Some symptoms include a change in sleep, appetite, energy level, and a couple more. Coping mechanisms include therapy and medications, or a combination of 2. In extreme cases, this can lead to self-harm or maybe even suicide. Some symptoms are feeling hopeless and having no purpose and isolating themselves, but there are a couple more. And some coping mechanisms include the National Suicide Prevention Lifeline, which is a 24-hour call service, and a couple more up there.
So eating disorders are severe mental health disorders where people cannot stop thinking about food. The most common of these are binge eating, bulimia, and anorexia. So symptoms of binge eating, which is the most common out of the 3, is eating past full, and this will give a feeling of being ashamed of what you just did. Coping mechanisms are avoid skipping meals and staying hydrated. The next eating disorder is bulimia, where people also eat past full but then purge their food by throwing up or eating laxatives. Coping mechanisms are learning your triggers. And then the next common one is anorexia, where people restrict their food and become severely underweight but still think that they're overweight. Coping mechanisms for this is just talking with friends and family.
So next we have addiction and substance abuse disorders. They are a huge problem in the United States. They cost our healthcare system around $600 or $600 billion annually due to decrease in work productivity and crime and the treatment needed to treat the patients in hospitals and rehabilitation centers. And these kinds of abuses of substances can last throughout a lifetime, and if any minor or any younger person takes up an abuse, it will most likely lead to a mental health disorder as an adult. And coping mechanisms include consulting a therapist in order to gain feedback and advice for later in life. And also exercising and staying busy will prevent any individual from abusing substances. And also understanding the root of the problem, such as emotions and situations that drive addiction.
All right, and so these are our references. Thank you all for listening.